Hello, welcome everybody. Welcome back to another episode of Your Health Matter OC. This is Dr. Clayton Chow. Standing in for Dr. CK is Jenna Saren. Jenna, say hello.
Hi, everybody. Good evening. Nice to be here this evening.
And we have two guests tonight. The topic is LGBT health. First guest is Mr. Pham Liu, who is a marriage and family therapist. And then the other guest is our returning guest, Dr. Jeffrey Vu, who is the Director of Clinical Services for the County Department of Public Health. So welcome you both. Before we get into a conversation with you both, let me give you an update on what's happening with COVID. So as you probably are aware, this last month at least, the cases of COVID has been increasing all over our country, including the state of California and the county of Orange. The good news is it looks like it is plateau this last week or so, standing at around 29 to 30 cases per 100K of resident in Orange County. Our 7 days case average is about 995 per day, and the positivity rate is 15.3. So that is also seem like it's going to be plateauing. We've seen that all over Orange County and the state of California. The hope is that perhaps soon we're going to be on a downward slope. Even though cases has been going up, and remember, we have said this repeatedly that these are reported cases, and we do know that there are individuals out there who use their own antigen tests at home, and those results are not reported to the state, so we wouldn't know. In other words, the transmission in the community is higher than what is reported to the state. I want people to know that. The good news is we've not seen a drastic increase in cases in the hospital as we did in past wave or surges. Today, the number in hospital in Orange County standing at 200, and out of those 200 people, 25 are in the intensive care unit. That's good news, like I said, compared to even the last surge or even this time last year when we was in the beginning of the Delta wave. The statistic that I'm going to tell you is very, very consistent, and that is the majority of people who are hospitalized are individuals who have not been vaccinated. And so we were told that at least 83% of individuals who are hospitalized out of the 200 folks that are individuals who are unvaccinated. And then people who in the ICU, the 25 people in the ICU, about 87% of them are individuals who are unvaccinated. So that's very important to know that people who, for one reason or the other, have not availed themselves or eligible for the vaccine ended up getting sick. So let me give you the statistic as related to the vaccination rate here in Orange County. We have now well over 2.3 million people who are fully vaccinated. Another 1.3 million of those folks have got the booster shot when they are eligible. So that's good news. So when you look at who are fully vaccinated and what percentage based on age group, the 5 to 11 years old, about 34% are fully vaccinated. And the 12 to 17 years old, about 68% are fully vaccinated. Senior over the age of 65, 100% of them got at least one dose, so that's good news. And 95.6% to be exact of the senior over the age of 65 have been fully vaccinated. You probably have heard that this last week, the CDC, the FDA, and the state of California have now authorized vaccination for children from age of 6 months to 5 years old. If you look at the screen here, there's two options, Moderna and vaccine. For a different age group, there's different number of shots that they need to get in order to finish a primary series. So please on the lookout for that. The vaccine should be widely available at least by the end of this week. And you can get it at all pharmacy. And you can also go on to our website at ochealthinfo.com to get signed on to My Turn, or get signed on to Othina, or to find out which site's closer to your home that you can get the vaccine from. As far as people who are tested positive, and there's a wide range of folks who are qualified for the antiviral medication, what we call therapeutics, to prevent the progression of the unit, as well the illness, as well as prevention of hospitalization. Please talk to your doctor if you tested positive and you have symptoms, to see whether or not you qualify for these therapeutics, right? Or you can visit the federal websites to Test to Treat program in our community, and the website is listed there for you. As we are walking into the biggest celebration for me as an immigrant and refugee, the biggest celebration in our country is July 4th, Independence Day. We want to make sure that you celebrate the holiday in a safe way, right? So please follow the recommended COVID-19 preventive measure. The most important piece, and you hear me talk about it all the time, the only way we can get out of this pandemic is if we get people who are eligible for the vaccine to accept the vaccine. So if you are eligible for either the primary series or the booster, please get a vaccine. Wear a mask, especially when you're indoor around crowded people or with people who you don't know their vaccine status, especially if you are somebody who are at risk or live with a loved one who are at risk, right? Keep physical distancing, that's the best way as well. And then stay home if you're sick, if you have any symptom at all, please stay home, get tested, and contact your primary care physician, okay? So another piece is be careful with the fireworks. You probably have seen the news that there are some pretty heavy fine from various cities if you are using illegal fireworks. So please celebrate safely and legally, I would say. So check with your city hall on what is the regulation and the law around fireworks in your city. So, Mr. Pham and Dr. Vu, welcome to the show. Thank you for joining us today, and thank you, Jenna, for joining and sitting in CK's seat to participate in this conversation. I think it's very important, seeing that June is the Pride Month for the LGBT community. But before we delve into that, I want to give people an update on CK's condition in case you are curious. I just spoke to her prior to the show, and I'm sure she's watching right now. CK has recovered well from her procedure, and very optimistic and very happy. Can't wait until she come back to work. She's bored. We've all have contacted her, and so grateful and thank to God that she's doing very well. You probably have seen last time on last show, she talked about the pink ribbon, and I'm wearing that in form of a tie and of a ribbon. This is in support of women and men to some extent, and family member who are recovering, and living with breast cancer. So please be supportive of loved one and friends and neighbors that you know who are going through this process. So good news, CK is doing well. Right. So let's dive into LGBT Pride Month, and let's talk about health. I think when I think about health for the LGBT community, especially the youngster, right? Kid who are struggling with their own identity. Mr. Lou Pham, can you talk a bit about what we know in terms of the statistics about their mental health?
I think what we know about LGBTQ youth mental health is that the last research really showed that LGBTQ youth experience a higher rate of mental health disorders such as depression and anxiety. They are 4 times higher comparing to the heterosexual counterpart. Additionally, when you're looking at suicide ideation, there's also higher prevalent rate of that as well. They are 4 times higher comparing to their heterosexual counterpart. And I was reading a research on the Travel Project where into 2021, they were doing a study on 35,000 LGBTQ youth nationwide, and they have found that over 70% of the LGBTQ youth mentioned that they have had experienced some type of mental health issue within the school system due to the bullying that they are experiencing there. So the statistic is obviously very high. And when you're looking at our LGBTQ adult population, they are also higher compared to the heterosexual counterpart. Everything is in the 2 times or more. Then you're talking about our transgender community, that skyrocket to even 4 times higher than the than the rest of the population. So there's a tremendous need out there for mental health services for the LGBTQ plus community, for youth, in addition to adult as well.
Thank you, Lou. The reason why I started the conversation that way, because I believe that an individual mental health, mental well-being really directly correlate with how comfortable they are with their own identity, right? Whether it be sexual orientations or even racial identity and what have you. And the process of acceptance is very important, especially for this population. As we know, many might not have very supportive parents. And why I'm looking at you is, as a nurse, I'm sure you have encountered patients from this population, and I know nurses are much more closer to the patient than physicians are, because of the type of care, the type of services that you provide.
Right.
Share with us some of the experience you have encountered, if you have encountered individual from this community.
Definitely. Thank you so much for the opportunity. And I think that, certainly to Dr. Chow's point, as a healthcare provider, there is often so many times that we have the interaction or the interchange with the patient, whether you're in a community health setting, an acute health setting, or even in your personal life. People lean into healthcare providers when they have questions. And I think the most important thing is validation and recognition, because everybody's feelings are unique. And whether that's what the individual is going through or for the family member to try to be supportive. I've had experiences with same-sex couples trying to conceive and seeking services for families that we want to assure the resources that they have are similar to many what new parents have. But occasionally people want to have an opportunity to also be part of groups that identify similar to what their circumstances are and how they might negotiate or move forward as new parents. So I think we've got some fantastic resources in Orange County. The LGBTQ Center is one that we frequently refer individuals to. But I think, when we're talking about our young clients, and we've certainly had families with children that may be questioning their sexuality or their gender identity, and it's having those parents be supportive. And oftentimes it's making the recognition. We may have parents say, well, they're too young to know that, or they're too young to understand that. And I see as a role, one thing that's really important as a nurse, as a healthcare provider, as an educator, and even just as a family member or friend, is validating that individual and assuring that people know we're listening to them and we hear what they're going through. And just as if we told somebody, something else about ourselves, this is no different. And so I think that validation and that recognition is incredibly important. And then assuring that people have, again, the resources. And if it's physical health things they might be dealing with, assuring they have access to that physical health care. If it's mental health services because they're feeling very sad, or especially with our youth, feeling bullied by individuals, we want to assure that we're really embracing and wrapping around the care and concern that we, are accepting of all. And I think these are just things that are so important for parents and as healthcare providers, hopefully we can facilitate that at all ages of the spectrum.
So I'm glad you brought up that issue because in my experience, many of the youth and even younger adults actually have a hard time coming out to their provider because fear of judgment, right? Because fear of, oh, well, is she or he going to treat me very differently,
Yeah,
right? You, Dr. Vu, provide direct services to this population, especially the transgender community, or especially individuals who are questioning or in the process of transition. Share with us some of the fear that your patient have shared with you.
Yeah. So there's some studies out there that say about 3/4 of transgender individuals don't want to reveal their status to their provider because they're afraid they're going to be treated differently or even be handled differently physically. And on the gay side, it's about 50% will even, and sometimes patients come in and they're coming in for a physical ailment and it doesn't necessarily need to be part of the story. But it is part of the story because there are opportunities to educate and treat the patient on a broader scale other than just the cough and cold. So many times we here at the county, we had a study with one of our groups, Alianza Translatinx, and it was a focus group of people speaking on their experiences of the health care that they want to receive here in the places that they live. And one of the issues that comes up is that providers are not necessarily prepared so they're cautious to reveal this kind of information, but also that the people that work in those places are not like themselves. So not having, as a clinician, not knowing this kind of information makes it difficult to navigate fully to see that patient as a whole person.
So that's the important point on how do you support the LGBTQ community, especially the youngster, right, to express themselves without fear of stigmatization, without fear of shame, right? So let us take our first video break. We're going to see a video about supporting our LGBT youth expressing themselves and learning to accept who they are and positive expression of themselves, breaking the stereotype. So let's take a look.
Growing up, a guy, you're taught to not emote, not express.
I was tired of hiding who I was.
I just knew that there was something different, about me.
Really couldn't express myself as much as I wanted to.
For a long time, I hid my femininity. I would go to school with the most straight outfit you could ever see.
I was told by family members and people at school, if you dance, you'll be gay and no one will like you.
I came to a point where I just did not want to be conforming.
Dance has allowed me to express my sadness, my happiness, my joy, my confusion, and I'm able to put that into my movement.
I feel as though I do connect with my masculine self, but my feminine self is just very natural. I don't just have to shop in the men's section. I can go right over there to the women's section, make it something that's so cute that I feel actually fits who I am.
Whenever I put on these skates, I can be 100% myself and comfortable in my gender expression.
It was really freeing to just embrace my femininity, throw on some eyelashes, do that makeup, wear girl clothes. That's how I choose to express myself.
Typically when I tell someone, hey, I'm a cisgender lesbian, they're like, you don't look gay. What does gay look like? I feel like being out on the bike with my long hair and the makeup, we're breaking those stereotypes by showing up.
Being gender fluid, it allows me to kind of embrace my full self.
Everybody can wear what they want. Everybody can express themselves however they want.
Let those parts of you out. Let those colors shine.
Keep all those outside voices away from you. Just remember the ones that support you, and those are the ones that truly matter.
It means being courageous, being confident and bold in who you are.
Welcome back. In case you just tuned in, this is Your Health Matters OC with Dr. Clayton Chow and Jenna Sarin, who's stepping in for Dr. CK. The topic today is about LGBTQ communities' health. And if you can send us questions or comment during the show, and the address for you to do that is yourhealthmatters@ochca.com, yourhealthmatters@ochca.com. Welcome back, Lou and Jeffrey. We have two questions already. So first question, hello, my name is Jonas. As a 17-year-old male, I am just beginning my exploration of sex and sexuality. I came out when I was 15, but lately I have been attracted to female as well. Is that normal? Should I act on my attractions? If there's someone else I can talk to about this, I feel like I am losing my identity.
I guess I'll start off first. I think that there's definitely, this is about orientation, sexual orientation, and the types of partners you choose for yourself. And I always say life is about experiences. And so trying to figure that out, it's still early on, and it's not that things can't change throughout your lifetime. And so as a clinician, I invite you to explore that, but in a safe manner, of course. So talking to your healthcare provider is important, but also if you feel that you're really at a loss and trying to explore it for yourself, then I do refer over to mental health services, which, Lou, you want to talk more about that?
It is absolutely normal. It is absolutely normal to feel the way that you are feeling currently right now. I think when we're talking about sexuality or gender identity is that we can't just put ourselves in certain box, right? A lot of time, society expects us to act in a certain way. And a lot of time when we tried our best to stick to that, but at the same time, we're hurting ourselves in that process, and we're unable to look at other ways of looking at different things as well. I think at this stage, it is great that you are able to explore, and as Jeffrey said, explore it in a very safe way and connect with other providers. We have so many providers out in the community for LGBTQ issue, including the center, including CCSS, for the clinic that I am working at. And then we also have Radiant or APAT. You can connect to any of the provider and really talk about the process of identity development and what is that like. And each person is just so very different. And it's so great that we are able to sort of explore that in the current climate today.
But it's not true that as the society much more accepting of individuals who are not heterosexual, and that it created an environment for folks to be able to communicate more, interact more with each other. There are people who really refuse to identify themselves as absolutely gay or absolutely straight, yeah? And then there are individuals who really doesn't matter and don't want to confine themselves to that box that the society has created for us for generation, right? So there's a question from Todd. Hello, I'm Todd at work. We have begun to be more aware of how we acknowledge each other. So it got me wondering, how do I know which pronoun to use if I'm not sure?
Pronouns are a fun one, and I think I always say that the only way to know someone's pronoun is to ask.
Very good.
So it's tough because it doesn't come up in normal conversation. I mean, sometimes it is, but sometimes it's awkward just to ask someone you don't know their name. And in the same way, you can ask. We can normalize how we ask someone for their pronoun. But the more important way of approaching this is to ensure that the systems gather that information from the beginning, so it's not a question that has to be asked. So this can come in the form of intake forms if it's somebody coming into a workplace, or if it was a clinic for our services. But even when we do name tags, putting down your name, so easy to put your name and putting pronouns there, so then other people don't have to ask, it's already there. Or on your Zoom or your Teams or whatever, making sure that that's already available. And the nice part is you could be the one who starts it, and it kind of just spreads amongst everyone else to understand that that is something that you're an accepting person, but also preparing and prompting others to do the same.
So the common three pronouns that I've heard people use is he, him, his, and I use that, and then she, her, hers, and then I've also heard, or I know people who use they, them, theirs, right? And so that's common, but there are others. Is there a website that people can go on and look at, hey, if I self-identify as such, here are the most appropriate pronouns that I could use? And the best way to ensure that people address you properly is when you send out email or what have you, you have your pronouns attached to it. Like I have my pronoun attached to my email address, and so there's no confusion for folks, and it's easier for folks to know, when I talk to Clayton Chow, this is the pronouns that he prefer, right? So I don't know, do you do that? Do you all do that?
I also have it in my signature on my email, yes. I think one of the websites that we used to help educate others with it would be, I think, whypronounsmatter.com.
Okay.
But I think there's plenty of opportunities, and you can just Google it, and there's a plethora of websites that will give you the options. And yes, you're right. He, him, she, her, they, them, and combinations of them. Don't feel uncomfortable that if you see someone that says he/they or they/he, they're either could be acceptable. But others that you may hear, Z, it, are others that you might hear more commonly. And really, at the end of the day, it's what feels right for that person, right?
What you said earlier, though, I want to transition to talk about now, kind of youth, adolescent at the age of exploration. And you brought up the issue of experimenting and not constricting to a certain sex, right? When you're talking about sexual activity, let us now switch to talk about protection, using protection, right? Not only for the purposes of communicable disease like HIV and STI, other STI, but also contraception, right? So, how do you start that conversation with your patient as a nurse?
I think it's a great question, and I find that oftentimes, being rather direct with individuals, and in some of our early conversations as part of the assessment as a healthcare provider, asking just very simply, are they sexually active? And if the answer is yes, it may be, is it with opposite sex? Is it same sex? Is it both sex? And I think that kind of helps individuals to know in how your tone even is when you're speaking, and that you're asking so openly, that they then feel that that door is open to be able to have some of the conversation. I may also be asking them something as simple as, are they planning to have a pregnancy? Is that something that they're interested in? And of course the answer is no. And when we're talking with youth in particular, we may, head down a road more about like, what are their life goals? What are their fears, their concerns? And as you get into the conversation, whether it's about protection of STIs or contraceptives, having a better understanding as to what some of their fears are, right? And again, as you were saying earlier, certainly understanding that some of our youth in particular may not be forthcoming. They may not be forthcoming with parents, guardians, or with their healthcare provider. So I think it's just starting that open dialogue with them and asking some basic fundamental questions. I've always found that to be very helpful in trying to be more direct, even when it's something that's a little uncomfortable, but it's how we say it and open-ended so that they can respond back and start to then ask questions.
No, that's so good from a nurse perspective. But what about from a parent perspective?
Yes, okay, so now you're going to make me put the parent hat on.
Mm-hmm.
Yeah.
Because I can tell you, I have siblings with children, and all of my siblings
Yeah.
are in mental health and healthcare and,
Yes.
and human services.
Sure.
But some of my sisters do a better job than the other in
Yes.
talking to their children about sex. So,
Yeah.
So
Yeah, no, thank
Nurse Saren,
Yes.
put on your mother's
mom hat, yes,
How do you
absolutely.
do that?
I think it's a really great question you pose, and I have always tried, whatever the topic is, though, to be very open with my kids, with friends, with family, and oftentimes it may stem more from they'll tell me a story. Hey, I heard this is going on, or hey, what about this? Or they'll ask a question. Sometimes I answer their question with another question initially. What do you think about that? What concerns you about that? And sometimes, there'll be direct questions. I've had other friends that, have older children now and are much older than even my husband and I. And they may say things like, well, what should I do? And how do I handle this? And do I really want to know the answer? And I think the answer is, yeah, we want to know the answer. And, sometimes kids will ask about personal beliefs, right? They want to know from their parent, guardian, their friends, what their perception is. But I really try to hold back on that. And I wear both hats, the nurse and the mom at the same time, because what matters to me is really what they think and what their journey looks like. And then how can I support that? Because we all know as parents, sometimes we're going to have to make decisions or support when it may not be what we would necessarily choose, but it's something that we want to assure that all of, people that we know are safe. And I have found that to be very helpful, is just kind of asking questions back and getting their thoughts and knowing that no topic is off the table at our house.
So I mentioned earlier, we're so used to talk to our patient, especially male patient, about the use of condom, male condom, right? And it's almost as if only male have control of contraceptions or protection and what have you. And I've always thought that is so unfair. So from a primary care physician perspective, from a primary care provider perspective, how do you talk to women and men about dental dam? Because there's a question from one of our viewer, and if I could just open it and read it directly so I don't misquote her. So Rachel asks, can you talk about the dental dams and why they are important?
So, we talk a lot about sexual health and STD, sexually transmitted infections. And although many people think of intercourse as the only way to transmit some of these diseases, oral health, anal health is also important. And so using barrier methods such as condoms are, mainstream, easy to get a hold of, free in many cases. But dental dams are something that are often overlooked or kind of forgotten. And so they are available, and it's useful for anybody who performs any oral sex with each other. And it can be used for any types of partners you have, but oftentimes for partners who are female identifying with female partners. So it's, again, just another way of creating that barrier, but it's a great point to point out. Rachel was the name, right? That a lot of people are not aware that dental dams are even an option, right? And so something to think on a personal basis for those of you who are listening today, or maybe know anybody who are sexually active, but even for clinicians to be recognizing that these are recommendations for everyone.
Okay, time to take another break to watch another video. This next video addresses another issue that is very important and too common in the LGBTQ community. So let's watch this and then we'll talk about it.
I'm doing this.
Born in a black and white world, we saw color in the mirror. Our sexuality, our gender, our identity were never quite understood.
I am transgender.
But we eventually found love for our own truth.
You good? It's okay, hon. I love you no matter what in the world.
And now joy is on the horizon. Health and happiness. These are our new destinations. But a factor that seems casual to some in the community can get in our way. Like tobacco. Yes, that moment at the bar, the occasional cigarette, it can undermine our future. Smoking can damage nearly every part of our bodies. Its addiction siphons money from our pockets, and it claims tens of thousands of LGBT lives every year. So why now inflict this damage to ourselves? No, this new life, free from judgment, free from the shadows, will also be free from tobacco.
This free life, freedom to be tobacco free. Visit us at This Free Life.
Welcome back to Your Health Matter OC. The topic of tonight is about LGBTQ community and their health. If you have any question for us, we still have time for you to send us an email at yourhealthmatters@ochca.com. So the video we just watched talked about the tobacco use in the community. Who's going to share with us the tobacco stat?
Well, actually, OCDE actually did a study, and that was about 2 years ago. They have an updated version of study, and they have found that they survey about 25,000 youth in Orange County, and about mental health in general. But one of the questions that they did ask is about tobacco use, and they did find that LGBTQ youth do report somewhat a higher rate of tobacco use and marijuana use compared to the heterosexual counterpart. So we do see that is a rise in our community.
So in general, tobacco prevention program, and I know public health has a tobacco prevention program. How much do we concentrate or target the LGBTQ community, especially you?
I would say that in general, there's always opportunities to do better, but there's available resources at the county for tobacco cessation. So if you're interested in it, there's a hotline phone number and access to get some of those resources. But also, tobacco cessation or also to quit smoking is something that you can bring up to your healthcare provider. These are things that are going to be covered by insurance if you do have insurance. And so it's as simple as having the conversation and trying to decide what the best way to approach that is.
Let's talk about what you provide from the public health clinic on 17th Street.
Yeah.
What services do we have available?
So I am the Director of Clinical Services, which includes our 17th Street Testing and Treatment Center. So this clinic is located in Santa Ana and is free to the public for our Orange County residents. So it is a place for STD testing that's free. And so if you're really looking for that one specific thing and you really are either concerned or not sure of the right options, and maybe you do have a primary care provider or otherwise, that is available for all of our residents here in Orange County. So it's a great opportunity to get a lot of these kinds of questions answered. So if you're interested in STD testing, HIV, we have that available right here in the heart of Orange County.
So Lou, there are people in the community who might not have insurance, right? Or might be afraid to use their insurance for issue around anxiety and depression as is related to their sexual orientation, or as is related to their relationship, same-sex relationship issue. What access point do we have in the county to support folks who have that need?
That's a great question. And here at Community Counseling Support Services, we offer no-cost counseling services to Orange County residents who's experienced mild to moderate behavioral health symptoms. The process for referral is extremely easy. You can call our prevention and intervention call center, and we have intake coordinator to do a quick 10 to 15 minute screening, and we offer an immediate appointment right away that you can see a master level trained clinician, whether marriage and family therapist or social worker or professional counselor, and then you can go through the assessment process, and you're able to talk to a mental health provider and really talk about the issue that brought you into counseling. And our services are completely no cost. We don't ask anything about documentation status as well. And if we somehow we cannot provide the assistance, then of course we will provide a refer and linkage to any community member.
Thank you, Lou, and that was the gist of Jane's question. So thank you, Jane, for sending that question. And then on a similar vein in terms of services, you talk about anxiety. What if there are other issues? So here's the question from Dan, one of our viewers, situation. Dan said, I'm recently divorced. It actually happened because during COVID, I realized that I couldn't continue living a lie. I came out to my family, who have been supportive and kind. Now that things are opening up in the world, I am starting to date, and I'm hoping to get advice on safe sex practices, how to ask if someone is tested, and how to navigate this community that I'm so new to. And the reason why I read out these kind of question and situation is because I'm sure, Dan, you're not the only one. Many, many people, especially people who came out later in their stage of life, have the same issue too. So who want to tackle this situation?
So it sounds like a lot of clinical, but thank you, Dan, for sharing your story. I think the purpose of Pride and Pride Month is about being able to share each other's stories and show others that they're not alone. So I think that this is a prime example that life is about experiences and trying to figure out what is right for yourself. You're very fortunate that your family is very supportive as you're trying to explore this. But as you do it, some of the onus is going to be making sure that you stay safe, but also as we have these conversations, making sure that we normalize asking these kinds of questions, right? Questions of consent, questions of testing. But one of the tactics that you can do for yourself is making sure that you get tested regularly. So again, our 17th Street Clinic is available for that as you kind of wonder how things are going. And there's a lot more conversations about education, about prevention of contracting these sexually transmitted infections. You can use things such as condoms, which we have available at several of our clinics at that 17th Street location. Or you can ask your primary care provider, of course. One of the things that I do want to make a big quick moment about is there is a medication out there that can actually prevent from the contraction of HIV. And many people actually don't realize that it's available to them. So it's colloquially called PrEP, but it's pre-exposure prophylaxis or prevention of contracting HIV. It's as simple as taking one pill a day. It's something that's covered by insurance, and if you don't have insurance or don't want to use your insurance, we also have this available at our clinic at the 17th Street Clinic. And so by taking this one pill a day, you are more than 90% effective of preventing getting HIV, which can cause a lot of other issues kind of in general, but we still want to make sure that we are reminding of people that there are other sexually transmitted infections that can happen, so we still want to get tested on a regular basis. Usually, good rule of thumb is at least every 3 months, and if you're wondering if you should get tested or not, the answer is probably yes, and go ahead and come on in. There's no too often of getting tested.
Talk a little bit about PEP as well.
Yeah. So again, pre-exposure prophylaxis is before exposure and you're kind of preventing it, not knowing what exposures you're going to have. However, PEP, as Dr. Chow was talking about, is post-exposure prophylaxis. So you either because of needle use or sexual encounter where someone may have been exposed to HIV, this is considered a medical emergency. The reason why it's medications that are very available. However, we need to start it within 72 hours. So it's a pretty short window post-exposure, right? So post-exposure prophylaxis prevention of contracting HIV. So this medication can be readily available from some providers and pharmacies. They do have it. But if you ever have a question, need access to it really quickly, Our 17th Street Clinic is open Monday through Friday, but many urgent cares and otherwise should be prepared to address the needs.
So if I was having sexual intercourse, male or female, and the condom, the method of protection, broke, then I should go in and see if I could get PEP, right?
Yeah.
Or if somebody just told me, oh, he or she's have some symptom or suspecting that they're positive and I am nervous, I should go and get PEP. Is that correct?
That's correct. And I think that similar vein, any kind of birth control or otherwise, is similar conversations, right? Morning after pill is an option. And then, of course, with PEP, if you use it, it is 2 medications that you take, 2 pills that you take for about a month. And then there's some regular testing, but we want to make sure that we're protected. So if this does happen, we're at high risk enough that we may want to transition over to PrEP. So again, having partners in your healthcare that you can talk to about this and making sure that you're being taken care of. And again, if you don't know where to get it or not sure about the advice you're getting, you can always get a second opinion, and 17th Street Clinic is there for you.
Great, thank you. Before we jump into our last segment of the show, I want to pay special attention to the issue of the transgender community, right? So our next video talk about a young girl's journey with being transgender and the love and support of her family. It's a great way to end our conversation in celebrating Pride Month. So let's take a look.
I don't think any parent ever plans to have a transgender kid. Having Rebecca tell us who she was a huge gift, but it also sets your mind spinning. What does this mean? Where are we gonna go? What it's gonna mean for her future and all of those things. And so there's lots of fears that come in, but none of them were about her. One of the things they teach you when you have a transgender child, when they transition, is to create a safe folder of documents that attest to who she is, that we are not forcing this transgender identity on her. And so you hear this and you're like, oh, I'm never gonna need this. And then CPS shows up at your door and you realize you do. And I think that's terrifying. The world can be scary, but there is so much joy. There's so much possibility for joy. And so we can look to the people in our life who love and support us as a family, who love and support Rebecca, and see the helpers around us. I also think we can see the change. There's a lot of hope out there. There's a lot of big and scary stuff, and things are really bad right now, quite frankly. They're really bad. But there's a lot of hope. When Rebecca first came out, her dad's a pastor, and so we had to teach our entire congregation about what this meant. And there was a chance that if it didn't go well, he would lose his job. We lived in a home owned by the church, and so we would lose our home. We could lose all of the things, and yet supporting her or not, there was no choice there. And so in doing that, we did a couple of things. We set some boundaries up to kind of create a bubble of support for her. We said, listen, you don't have to understand this transgender thing. You don't have to endorse it or support it or whatever it is, but you have to use her name and pronouns. And you can ask us all the questions you have, but you can't ask them in front of her. And so as a result, people struggled. They had questions. They didn't understand. But she never experienced that at 8 years old. We dealt with that for her. And what we saw in the impact of that was, maybe the loudest, most opinionated church member who was like, if there's going to be a problem, it's going to be this guy. The first Sunday that she showed up at church as herself, after church, he came up to my husband and said, I don't understand this whole transgender thing. But she used to hide behind your wife and refuse to say hi to me on a Sunday morning. And today, she ran up to me, twirled in her dress, and gave me a high five. What more is there to know? But I think there's a gift in raising a transgender child because they teach you so much. They teach you what it really means to love the person in front of you, not for who you thought they were, or who you expected them to be, or who you wanted them to be, but for who they are. That's a massive lesson. I want everyone in the world to have that lesson.
I think having you as my parent has been amazing. I think You have raised me in a way that I can thrive. Without like the lessons that you've taught me, without you teaching me so much about empathy and how important it is to talk to people and to, I don't know, to think of yourself in their shoes, I wouldn't be as joyful as I am. I wouldn't be who I am. And so thank you.
It's my pleasure.
Is it?
It is. It is. I mean,
even when
depends
I
on the
annoy
day.
you.
Yeah. I mean,
A
could you
lot.
clean your room? Like that'd be cool.
No. It's too much work.
Welcome back, and I hope you are touched by that video we just showed earlier about a young girl's, I think, courageous journey through transition, right? In identifying herself as a transgender individual. We have a question from Lisa. Lisa said, I made a new friend within the community. And because of what she's asking, I assume her new friend is someone from the transgender community. Do you have resources where I can learn more about transgender and intersex communities to make sure that I'm not offending my new friend with any lack of knowledge or awareness? So before you answer that question, I think what you said earlier is really important, and that is, if you don't understand, ask, right? There is no fault in that. And in fact, people appreciate if you ask because you want to learn more, right? Any situation, whether it be someone from a different culture, someone from a different background, if you want to understand them more, if you want to understand their culture, just ask. And I think people appreciate more. I don't know. Do you agree? Do you disagree? What other tips or advice can you add to that?
I think asking is very important too, and also that it's okay to make a mistake. For example, you mispronounce someone, and it's okay. You can just just say sorry, and then you move on from that. There are many resources out in the community to learn about our transgender community. For example, in Santa Ana here, there is a great organization, Alliance of Trans Latinx. You can also go through the LGBTQ Center. They have numerous programs that focus on our transgender youth and also young adult as well. You can also learn from the Human Rights Campaign website as well. And there are many other organizations that provide services to the LGBTQ community, including CCS as a program I'm from, APAT in Garden Grove, Radiant. So all of these programs will be able to offer that resources that are desperately needed in our community.
One of the things that break my heart truly is to hear from individuals in the transgender community complain of the barriers as well as the inequity in healthcare, right? And that people are not treated based on who they are, but a mistake often made by clinician, physician, healthcare provider in doing the appropriate care for that individual based on not only their biological identity, but their own identity. Right? Talk a little bit about what you have seen in the transgender community.
Yeah. So I would say, really, Dr. Chow, it's all of the above. And certainly we have examples of clients experience, personal friends that have experienced that type of, it feels very lack of knowledge, lack of care. And I feel like as a healthcare provider, it is absolutely our responsibility, certainly when we're engaging with the client, to ask these questions so that we can treat everybody with the same level of respect and understanding and really where they're at. But I also feel that there is a lot of education we need to do amongst, our workforce. And as, your chief nursing officer in this agency, that's something that we have certainly been looking at and addressing, is assuring that all of our healthcare providers have knowledge and understanding of the care of individuals that either maybe questioning or maybe in different processes of trying to identify. And we want to assure that we're not only being sensitive to that, but we're being knowledgeable, and that we can get the right resources here that are within our county, but within our care, we're being sensitive to that, because we certainly, have examples where clients have not felt that and have felt very much either, discriminated against, or even when they tried to explain the circumstances, individuals felt that maybe people just didn't quite understand. So I think, as an agency and as an entity, a lot of our work can be in providing education and assuring that we're rendering the best care possible.
So from a primary care provider perspective, I know you specialize in the transgender community. What do you see and what are you trying to correct to gain the trust of the individual in this community?
Yeah, I think that to Jenna's point, that there's a long ways to go. That there's, unfortunately, and not to excuse our medical community, but they're just not prepared. And so we're working on trying to bring people up to speed, but also making sure that there's a network of resources. So if you have questions, the intention is that not necessarily that everyone has the right answer, your clinicians or otherwise, but that there's a network of support where people can answer those kinds of questions. So yes, there are community-based organizations, but there are providers out there who are prepared to answer those kinds of questions. So trying to navigate that, entering into some of these community-based organizations will get you to those places and get connected. So on the primary care perspective, or on a community-based perspective, or even from the county perspective, I think this is a priority for us and something that we are working towards. We understand that the transgender population is a marginalized population and one that should be focused on. And I think that as a healthcare agency, we are committed to addressing the needs and understand that we could still do better. And there are things to come forward in the future, I think.
So for a provider in the community, let's say a primary care provider who have a patient who from the LGBTQ community and have, issue with their mental health and need services, what phone number can they refer the patient to?
I think for our county, the number one phone number is, of course, through OC Links, right? So their number is 855 OC Links or 855-625-4657. And you can call it 24/7 hours, and you will be able to connect to a navigator, and then they can assist you in reaching out different resources. And I myself personally know some navigators there, and they are fantastic. Reaching out to us, I think it's just a step to be able to reach out. That's very, very important too.
Thank you so much, Lou. I want to thank our guest tonight, Dr. Jeffrey Vu, for coming back to the show. I want to thank you, Mr. Lou Pham, for coming and talk to us about very important information. But Jenna, thank you for stepping in for Dr. CK.
Pleasure.
You did a wonderful job. I think she's feeling threatened right now.
Nobody
you did
can
a wonderful
replace
job. Pride Month really is a month to celebrate the LGBT community. But I'm hoping that we'll get to the point where, as a society, we don't need to set aside a month to raise awareness, and that we all are aware that there is different people exist in the community, and that we should respect people just for who we are as human. And for the healthcare provider, I'm hoping that they will find themselves the knowledge to treat individuals from this community. And if you don't feel comfortable in treating individuals in the LGBT community, you do no harm and you refer them to specialists like our panelists tonight, right? And there are other specialists out there. So do no harm. From a medical professional perspective, we took an oath to do no harm to our patients. So if you're not sure, seek consultation. If you're not comfortable, it is okay to refer to a different provider who are comfortable. But obviously, the ultimate goal would be everybody else is comfortable with everyone, right? And so it doesn't matter which cultures you're coming from. We as human should relate to each other as human, because that's what God created us for. So thank you so much. I don't want to get so philosophical and then get teary about this, but to all of the individual in the LGBT community, we celebrate you this month. We celebrate us this month. We celebrate a community that loving everybody, right? I think that's a saying that love win, right? Is that true? So hopefully that's the piece. Love between humans wins over all adversity and inequity. So our next show will be July 12th. We will be talking with some experts and family members who are also grieving parents, working very hard to draw awareness to this warning and I think national crisis, and that is the amount of fentanyl use and fentanyl death in our community, especially in the young population. They have created an impactful video called Dead on Arrival, which is I think I heard it is an award-winning documentary or being considered for award. I'm not sure, but please don't miss it. This is a very important conversation. So until then, I hope you have a wonderful July 4th. To me, most important holiday of the year, but celebrate it safely, right? Get tested if you're symptomatic, stay home if you're sick, get vaccinated if you're eligible, and most importantly, when you're in crowd, especially indoor with poor ventilation, with people you don't know, wear a mask, especially if you are someone who at risk or live with someone who are at risk, right? So with that, have a wonderful July 4th, and be safe and be well. We'll see you in 2 weeks. Thank you.